see your circuit. Remember, when all else fails, you can read, so there's instructions inside the packet that you should keep. It shows you how to assemble, or it tells you about how to assemble the nebulizer. And why? This just tells you the pieces. Actually, the older circuit actually had a picture that would put it together for you. Always be packaging. All right, let's open up the packet. Again, package sterile, but you want to be aseptic. So there's a mouthpiece in here that you can assemble without touching it. I'm holding the mouthpiece with plastic. I'm connecting the mouthpiece to the 6-inch piece of corrugated tubing that comes in the circuit. And so here's the mouthpiece and a 6-inch piece of corrugated tubing. If you're should wear gloves when you're doing this with your patient. And so you could use clean gloves to do that. But here I'll leave that in place. I'm going to pull out the circuit. Inside the circuit, you also have a 22 millimeter adapter, and you have this short piece of tubing that connects the nebulizer to the exhalation valve. As I open up the circuit, you see that I have about a 3-foot piece of corrugated tubing. I have 2 pieces of plastic that hold the tubing to the corrugated tubing. I have a piece of oxygen supply tubing, and then a piece of tubing that doesn't have the connectors that O2 supply tubing has. So you can take the oxygen supply tubing off, save it in your box. It's just a piece of O2 supply tubing that you have. This piece of circuit doesn't have the end of oxygen supply tubing. They've been cut off. You take the piece that connects to the nebulizer. There's only one way in which it'll go. Connect it to the nebulizer, the blue piece of the nebulizer. Take the short piece, connect to the exhalation valve. Take the other piece that goes to the unit supply line and connect it to the top of the nebulizer. Now you have the circuit set up. The exhalation valve is directional. You can point it in any direction so the patient's exhaled breath doesn't go back into their face. It doesn't go towards you. You can point it anywhere that you want. I'm going to open up the nebulizer in a second to show you that it actually has an anti-spill cap. So I'm going to turn it sideways so that you can see it. Here's a nebulizer where you pour your saline or medication, and here's the anti-spill cap. You can actually look at it and also see that that's where the gas flow would come through and where the Venturi effect Bernoulli goes in. The nebulizer is graduated so it'll hold up with about 20 mils of solution, and you connect it as so. Also in the circuit is, again, the 22 millimeter adapter, so that you can connect the active bead. Most of these circuits will not come with the piece for the expiratory line, nebulizer line on the IQPD unit. What you'll tend to probably do is you'll take those off of the circuit. We have a couple of extra, but if your IQPD unit doesn't have that on it, someone, whoever used it last, took this piece off of the unit. Make sure this will come out. If it does, it comes off of your circuit. Make sure that you put it back on the unit. You need that to connect the 2 lines.